You should definitely be asking yourself some questions before you undertake any in-country sexual health education to make sure you are not in any way endangering yourself or your counterparts or the reputation of yourself or your counterparts or your darshabab or anyone else for that matter. In general, ask yourself, how does this topic apply or pertain to my community? Who are my counterparts? Is my community able to have this conversation? Do people in my community feel comfortable and open towards me? Open towards my counterparts? Do I have a safe space to hold this discussion? Will that space allow for confidentiality? Do I have the proper resources? What assumptions am I going in with? How will I keep them in check or find a productive way of expressing them? Do I have a cultural understanding of these topics? Do I know someone else who does and who I have invited to the event or class? What are the common misconceptions surrounding this topic? Who is my audience? What are the potential backlashes and hard questions? And what is my overall goal? In order to further prepare, we have some questions from our toolkits regarding some specific topics. Regarding consent, how do people in my community define consent? Who is allowed or not allowed to consent? Why would this lesson help or benefit my community? Family planning. How is family planning viewed and used in my community? Who has access to family planning resources? What type of family planning would benefit my community? Regarding healthy relationships. Culturally and religiously, how is healthy relationship defined? Do genders or ages have different definitions? Regarding puberty and development, what are the medical components that need to be covered? What are the cultural components that should be addressed? What resources are used and or are available to my community? Regarding maternal health, what resources are available? What needs are and are not met? And who is an active participant in pre- and postnatal care? With these questions, it's good to go over your own judgments and theirs. We also wanted to leave you with general do's and don'ts in sexual health education. The do's in sexual health education. Correct misconceptions when you hear it in a non-confrontational way. Identify and work with local organizations that are willing to distribute and talk about condoms. Assume extramarital sex is a problem, even though it is denied constantly, but don't mention that to your students. Make information available. Encourage health centers to distribute condoms and to have CETA education programs. Find opposite sex allies to encourage prevention methods. Go over a script with specifics to any counterparts long before you host any sessions in your community, and always provide an anonymous way for folks to ask questions. Also, always provide them with the tools to continue to do research on their own if at all possible. The do-nots of sexual health education include: don't talk about sex in a mixed gender setting, don't distribute condoms, don't imply extramarital sex is normal and should be accepted, don't use personal sexual experience as examples ever, don't assume that they do or do not know about CETA or STIs or any other sexual health education topic, don't inquire about Moroccan sexual experiences, and don't ask counterparts to translate or talk about any topic you have not already okayed with them beforehand.
Created using Powtoon.